Welcome everybody to our woman to woman interview, and I'm super excited to introduce you to Carrie Ballas. And Carrie is a nurse practitioner who is a hormone expert, a functional medicine practitioner, and a whole host of other amazing things. And I'm just going to let Carrie tell us about herself and her practice and where you're located and all that good stuff.
Oh, great. Thank you. Thank you for doing this. This is exciting, and promoting women, helping women, which is awesome. I have been practicing in Boulder since 2008, doing mostly hormones. I started in, I guess in 2007 to 2008 doing hormones, and then just started working on my functional medicine degree from there, which has just been building and building and building, and then finally got certified from the A4M in functional medicine a couple of years ago. Which is a really cool approach of looking at someone and taking the whole picture and saying, where are things imbalanced and how can I help to rebalance that in partnership with my clients. So I have clients of all ages and sexes, and I have a big focus with women. And just because I started out doing hormones, and I kind of have been growing doing that over the years. And also, hormones are a foundation in anti-aging or in overall healthy aging. And so I believe strongly in that as a big foundation for getting people to be their more optimal self, but also they just feel better. And I do women and men, but I love working with women. It's definitely way more complex and but very rewarding, because there's a lot of things that can be imbalanced, and when they feel better, it's like, whoo, women are going to take over the world. No, just kidding. They are really just,
no, we are
in a really amazing way. Yeah. So yeah, practice. I now have a practice by myself. I've been with other clinicians over the years, and so. But solo practice since 2008, but in a new location on 2575 Pearl Street in Boulder. So yeah, so it's all happening there. Lots of fun stuff.
Awesome. Well, your name, like I told you before, your name comes up all the time on my treatment table, because we're talking about hormones with my patients, and they're talking about all their symptoms, and like, well, Carrie says this and Carrie says that. So like, I feel like you're part of my practice already. But yeah, it's like, oh, but one of the things I want to find out from you, like I like to ask different practitioners this, is like, I know we all know like the typical like hot flashes and like night sweats and anxiety and like some of those things that come up. But if we were to talk to a woman that maybe is in her like mid 30s, early 40s, or even mid 40s, like starting through perimenopause, and she's not having hot flashes or anything like that, but like, so I'm just aware that perimenopause happens sooner than we think, right?
Yes.
So what kind of things would you tell someone of that age group that may not be having these symptoms, but what should they look out for, and how would they want to seek out help for that?
Such a good question, and such an underrated place of information, because I think people are waiting and saying, oh, this can't be a hormonal thing because I don't have hot flashes, like you said. So for the early signs, and this can happen I think I started perimenopause must have been like mid 30s, where I think for a lot of people, it's sleep starts to shift a little bit. Their stress intolerance starts to shift. Maybe that means a little more irritability, a little more quick to react. Maybe their PMS time period, which is before their cycle, gets more intense. Maybe not. Sometimes people get night sweats before they get the full-on hot flashes, or like a night flush. So I hear that from people. Brain fog, weight gain that doesn't make sense are really, really common ones. Just in general, fatigue. So those are pretty early symptoms of hormone shifting, and vaginal dryness, maybe starting to see some irregular cycles, or maybe it's getting a little longer, or maybe it's shorter. Typically it gets a little more shorter and a little heavier because we lose progesterone first in our perimenopausal state.
Okay.
And so then you have a little more of this estrogen dominant feeling. And there's comes some of that mood and irritability and some of this intensity, maybe irrational feelings from the mood perspective. But yeah, when we lose progesterone, we have this symptom of being a little more estrogen dominant. And so cycles, when we have estrogen dominance, we start to bleed more. So I would say that's a more common symptom is heavier bleeding or spotting between bleeding. Those all can be symptoms for sure. So yeah,
Okay.
things to watch out for. And then we can test early and say, oh, okay, well, let's track this. Maybe there's some natural things we can do early on before actually going into replacement of hormones, or you start with some progesterone, which is bioidentical progesterone, which comes from yam, and that can help balance that estrogen, and that's what we should naturally be making, but our ovaries just can't quite make enough of it during that stage. And then that can be helpful and supportive until the ovaries more shut down more towards the menopausal time, you know.
Yeah. I think it's just really hard to decipher. Like when I know I was probably going through perimenopause earlier than I thought, and because I had my daughter when I was 42, and so I was like probably in the throes of perimenopause then, but didn't really realize it because I was going through all this other stuff. And so just like thinking about like how I would have gotten better support then if I had known better.
Yeah,
So
if we have more awareness around it, people don't wait until they're feeling miserable. Like
right.
I actually personally haven't had very many hormonal symptoms because this is what I do. And so I've been on progesterone since, my late, I don't know, 37 or something. And so, I don't struggle with flashes or irregular cycles or anything like that. And so, but I bet if I wasn't, I'd be feeling a lot more miserable. So I think looking at some of those symptoms ahead, watching for some of those signs, particularly a little bit of the irregular cycle and maybe some of those symptoms I mentioned would be worth, seeking some assistance. So yeah, I think that can be a really important time to be on top of it. And we can't confuse the fact that, or it's very confusing, I should say, is when we have, oh, is it a thyroid issue all of a sudden?
Right.
Or is this, my adrenals because I'm stressed out? And yes, it can be all of that, which could exacerbate the symptoms too. So when somebody comes to me, it's really important to look at all those pieces because those can throw hormones off,
Right.
So
yeah, like the adrenals they can totally mess with the rest of your hormones, right? So
absolutely.
So where would you go there first? Like where would you go first in someone of this like age group, right?
Yeah, I think that's a really good question. Everybody's so individual. I really test the symphony of the hormones. So I really do the HPA axis system evaluation, which is adrenals, thyroid, and sex hormones.
Okay.
And then I see where the imbalance is. Oftentimes the adrenals are really like we're all stressed out. So I really like to address that first.
Yeah.
Because then you're going to tolerate adding the hormones and symptoms might shift a little bit there too. So I think really addressing adrenals is pretty first and foremost, but sometimes that's not the only answer. Their DHEA starts to get affected, which DHEA affects all the other hormones. And so that's a precursor hormone, just like pregnenolone, which is made from the adrenals and in the brain. And so when those precursor hormones start to decline, we could even supplement with those, which could be considered supplements. They are hormones, and then that helps all the other hormones. So those are kind of early things we can do that, without somebody having to go into the whole big thing, So yeah.
And I'm sure you have to look at lifestyle too, like diet and, gut and all that other stuff. But
It plays into it. So the more inflamed we are, the more symptomatic we are. Certainly stress, yes. But, if somebody's eating inflammatory foods or if they've been exposed to, let's say, parasites or gut microbes or whatever is happening there, that's going to drive up overall inflammation. And then therefore, our hormones don't work as well. It's more depends on the cortisol system or the adrenal system, and we produce more cortisol. So that really does factor into things. And so, really putting people in touch with what they're eating and saying, oh, okay, you don't have to be necessarily so strict right now, but take away some of the inflammatory foods, and for sure, alcohol, sugars, things like that, that can be problematic and just drive up, inflammation for most people. It's a great way to start, and a lot of people could, before you even seek a clinician, you could just say, hey, let me do like the conscious cleanse. 2 local nutritionists came up with that. It's great. It's anti-inflammatory diet that we all know about in functional medicine, is taking away some of that inflammation and seeing how you feel. And really hormones work better and adrenals work better. So because there's less stress on the body.
Yeah, everything works better when you're less inflamed and for sure. And I know that the whole genital urinary kind of system, a lot of my patients don't realize, like if I ask them if they have vaginal dryness, they say no, but then they start talking about other things that they're feeling. I'm like, well, I think maybe your hormones are kind of, not working optimally, because there's definitely it feels like tissue change for me,
Absolutely. Right.
Not necessarily,
you can see. Yeah, and that affects a lot of things. That can put someone at risk for urinary tract infections. So someone getting frequent urinary tract infections, a lot of time it's low estrogen. If we don't have enough estrogen and testosterone, we have lack of blood flow, because both of those create vasodilation, which helps with orgasms and, and blood flow, which is helping with dryness and things like that. So yeah, I think that we need to pay attention down there. So
for sure. Yeah. It's just interesting. Like, I think that's what I help women do, is reconnect with that area, because a lot of us, after we've had trauma or childbirth or anything like that, you kind of disconnect from that area a little bit, and you're not really sure, like, no, I don't have vaginal dryness. But then when I'm working on them, they're like, oh, come to think of it, yeah, maybe I do. And, so I think just kind of thinking about how your body is responding to certain things is super important, right?
Yeah, I think that's so true. And I'm glad you're bringing up trauma and our root chakra, right? Energetically, there's a lot that we hold there and a lot that we block off there. And so I love that there's practitioners like you who really help with that. I think if people are willing to do some trauma therapy, certainly breath work, anything you can do to really, revitalize that area. And I think, particularly in a safe way, if somebody's with the trained therapist, if they've had some trauma, is important, because it's a huge energetic channel that is important for us for everything to move, right, and to feel more vibrant in a whole body way. So yeah, important to look at. Absolutely,
for sure.
Yeah,
I have another question now. You touched upon bioidenticals and YAM.
Yeah.
Can you just, for the people that don't know what bioidenticals are, can you just explain that a little bit?
Oh, great. Yeah, absolutely. So bioidentical hormones, we can have over the counter, and then we can have prescription hormones. So bioidentical hormones are coming from plants, which estrogen, testosterone come from soy, progesterone from yam. But these are not identical to what molecules we make as a human. So labs will convert that to match our human structure identically. So when we take those hormones in, it's as if we were making them the whole time, right? So same hormonal structure, opposed to Premarin, which is horse urine, or synthetic progesterone, which is called progestin, and birth control pills. All of those are pharmaceutical driven, and they don't match our human structure identically, because you can't patent nature. So pharmaceutical companies have to manipulate those hormones in order to be able to deliver them and in a way that they can make money. And so what happens is that we can have kind of rejection of that. Our body doesn't metabolize that in the same way. And so that's when some of the risks go up. And I think that's where people get very confused. In 2001, the Women's Health Initiative came out that, women's risks go up because of hormones, and they were using Premarin, horse urine, progestin, which is a synthetic progesterone. And so then they said, all hormones are bad, but really didn't factor into the fact that, if we replace what we make naturally, that's the most natural natural thing we should do. And that's very different. And the studies are supportive for hormones, supporting your bones, supporting your cardiovascular system, your brain, all of those things when used in a bioidentical way really are not going to increase your risk. Now, if you have an inherent risk and you're still taking hormones, that's another conversation. And I can mitigate that by monitoring and evaluating that through urine testing and whatnot. So when we work with a hormonal structure that's identical, our body is much happier. And so I can prescribe that for patients in different forms. And we can do capsules and creams and patches and different things. So it depends, and that's super variable as to what works for the patient. But in general, it's the best way that we can assimilate the hormones. Yeah.
Do you do the pellets too?
I don't do pellets, but pellets are bioidentical.
Right.
Yeah, I don't. I think there are some benefits. There are some negatives if you get a pellet and it's in your body and you get over pelleted. Is that a word? You get overdosed. You can't take it out.
No, yeah, that's been one of my beefs about it. People, practitioners have been trying to get me to do the pellets, and I'm like, no, I'm not gonna do the pellets.
I know, and it happened to me.
I mean, I know it's helpful for people, but not for me. I don't. It's not for me.
I think it's just what works for different people. Some people like it in there because all they have to do, they can have testosterone and estrogen in a pellet, and then they have to take progesterone on their own regularly, but then they go in every 3 to 4 months for the updo of that. I do think some of the people or the programs doing pellets aren't managing hormones in looking at urine methylation, how safe are they? So that's my only concern, is sometimes some of those programs don't really assess it in that way. But if somebody is looking at all those pieces and measure hormones properly doing it, I think people do find it beneficial. But I don't feel like I need to do that for my patients to feel well. So
cool.
Yeah, but yeah, they are bioidentical, which is good.
And you mentioned patches, and are your patches bioidentical?
Yeah, that's just such a good question, because some people come to me and they're like, oh, I'm not on my bioidentical hormones, and they show me and they're on the estradiol patch. So it's a really good question. The patch is still bioidentical. It is estradiol. The pharmaceutical company has been able to patent the actual patch delivery system, which is why they can get a patent on it, even though it is bioidentical. But the problem is that it is just estradiol, and it's missing estriol, which is another hormone we make, another estrogen we make that is actually very protective. And so we like, in a functional world, a lot of us like to kind of use a 2-prong approach for estrogens, estradiol and estriol. And so that means we have to get it compounded because estriol is not commercially available. So I would say for more protection, I commonly do something called Biest, which is a compounded cream typically. I do have patients who are on estrogen patches. They do have glues. You have to move it around, on your belly. So it's a little foreign thing that's on there, but it is bioidentical in a great way. So a lot of times practitioners want their GYNs to do something, and they can do bioidentical estrogen patch and a prometrium progesterone pill, and that's a nice approach for people that sometimes insurance will cover. So
cool.
Yeah, good question.
Very enlightening. So one of the things I love about you is I was looking on your website, and you had you mentioned something about you want to run your business in a feminine way.
Yeah.
That just like made me happy. So can you talk about that?
Well, I just think that first and foremost, it's a relationship. I am not coming down from this is authoritarian, which is I tend to equate with masculine, a masculine approach of, oh, I know this is the only way.
Yeah.
I ask people, what do you intuitively feel? Because a lot of times women are excluded from their own intuition about what's going on for them. And it's like, that's ridiculous. They have a very good sense, of what's going on. So it's asking those questions. It's approaching it from a partnership way and saying, hey, this is a way, this is, how does this feel for you? And these are some treatments we can come up with. So I think that partnership, I think that I really, really like connection. COVID's been hard for me because I thrive personally on human connection, and the more connection I can have, the better clinician I am. And sometimes it's 40 minutes into the visit that I'm like, intuitively, I'm like, oh, that's where that's coming from.
Yeah.
And it's, I think by being, having an feminine approach is also kind of like navigating the nuances of what someone is telling you, so you can really gather from that maybe what is also a problem for them that's maybe not stated on their intake or super obvious.
Yeah.
And so, yeah, it takes some finesse, which
I love that about you. And that's awesome. And, you know, the whole collaboration thing, that's how I operate too. And that, you know,
right?
it just made me giddy that, you know, you had that on your website. That was
Good. And yeah,
yeah.
collaboration, you know, it's, I have a way in my modalities, but you know, referring to someone like you who does all this work in the pelvic floor, and I know you have other treatment modalities, but that's so important. And you know, getting someone's nervous system with
Yes.
acupuncture and making sure if they're confused about their diet, working with a nutritionist. And so collaboration is really important. And I think also that's a very feminine approach
For sure.
of making sure everyone has or a client has different approaches to help them feel well, because there
Yeah.
are so many ways to do it.
Yeah.
Yeah.
Yeah. It's the whole, it takes a village kind of
Oh,
thing,
gosh, it's
right? Yeah.
yeah. Yeah.
Yeah. Perfect. Sweet. So one more question, and then I'll just, you can tell me anything that comes to mind.
Okay.
But the one other question I have is just that I know you do IV therapies as well, and just if you can just kind of speak to IV therapies, because that's becoming more popular in the holistic health world, what the benefits are of that, and just how it kind of interplays with the hormonal therapy and all
Awesome.
that.
Great question. Yes, I love IV therapy. Everyone, if you haven't tried it, you should try IV therapy. Ideally with, you know, a clinic that has nurses and is more in tune with the medical side than just a kind of a random clinic. But using hormones or using IV therapy can help hormones specifically, because methylated B vitamins, which are the foundation in a lot of IV therapies, is key for liver support, and our hormones are metabolized through the liver. So that's one thing. We also utilize more B vitamins, magnesium, things like that when we're under stress. And so if we can replace those things, that's going to be more beneficial. And really we get a very, very small percentage of absorption of things we take in orally. And so IV is 100% absorbed. And so that's just like super potent to the cells. And so then everything works better. Utilizing vitamin C is one of the biggest tools of reducing inflammation. And as we know, inflammation drives most disease and dysfunction. So if we can do that, that's great. And it just helps people feel more energized and vibrant. I also am doing really, really cool IVs, or doing a really cool IV called NAD, nicotinamide adenine dinucleotide, which is the byproduct of the Krebs cycle to create energy. And so when we have fatigue, if we can repair that energy cycle, NAD is a way to do it. And it's super potent to get into the cells when we're doing IV therapy. So I'm having incredible success stories with patients doing that. And it can help rebalance the sleep-wake cycle. It really repairs almost every system, because it's involved in every action of our cells and our mitochondria. So that's super exciting. And then we have all sorts of other things. Phosphatidylcholine, which helps with the brain, because a lot of times people have brain fog. And so glutathione helps us detox. Our environment is full of toxins. And the more toxic we are, toxins are endocrine disruptors. And so that will impact our ovaries and as women, and that impacts how we produce hormones. So if we can detox better with B vitamins, but also glutathione, that's an excellent way to get better and feel more optimal. So yeah.
Sign me up.
I would be there. I'm like, I need a course, like have every single day and just like really quick access. Like it's just one of the best things we can do. But yeah, that's really rewarding. And my nurses are really, really excellent. And it's a really pretty space. Everybody says they just feel really
relaxed,
like, lovely and relaxed. Yeah. So that's a benefit.
That's awesome.
Yeah, you should come in.
Is that like a short-term thing, or is that something that people do like regularly, or like how does that work?
Oh, that's such a good question as well. Depends what your goals are. So some people are fighting infections, and so it's a
Mhm.
short-term thing. Or like one of my good friends did in the winter, she does like weekly for a month to two, and then just when she needs it, and basically doesn't get sick the whole winter.
Mhm.
Um, NAD, unfortunately, is more ongoing
Okay.
because we can get things repaired, but then it's like, oh, okay, that does decline. So many people are doing that weekly until they meet their goals, and then they can
Mhm.
kind of do it kind of as needed. But I think a lot of biohackers are doing it weekly, just keep that body
Okay.
in an optimal state. But yeah, I think if somebody's had recent surgery or acute things, then yeah, you'll kind of do a
Mhm.
series of some IVs, and then wouldn't probably need them. But definitely for anti-aging, if someone could do a series, build up your levels, and then somebody could come every month,
Uh-huh.
a really great way to support the body too. So yeah,
So
yeah,
can you do you just go in and get your menu like you're in a cafe? Like, I'll
yeah,
have
yeah,
this.
exactly. Yeah, we have a great website called ivboulder.com, and it talks
Uh-huh.
for all the IVs and a little bit on the functions of there. And so
Mhm.
sometimes people come in and they know exactly what they want, and then other times
Mhm.
people are like, I don't know, I just feel this, and then the nurse can help guide them, which is super.
Okay.
Yeah, you don't have to worry. You don't have to know all of it.
I want it
My skin, I want my skin to be amazing. I want my liver to be happy. We can help you with all that. But yeah, I think that the more we can do those things, then our hormones work better. But also we just feel more vibrant, right?
all.
So if we
Mhm.
feel and look more vibrant, then we're um, doing better work in the world because we're more resourced,
Right.
we
Yeah.
can share our gifts, and that's my
Awesome.
takeaway. I mean, I don't know if you have any other questions, but my personal goal is to help women and men, but women, when they can feel better in the world and more resourced and more optimal, then they can go out and share all of the gifts that they have, and that just goes to their family, the extended family, the communities, and the world. And so that is would probably be the biggest blessing for me in the work that I do, is to help
Mhm.
people thrive so they can contribute more to a better, brighter world. It's the way to be.
That's
Yeah,
amazing.
yeah, it's
I
really
love it. I'm with you on that 100%. And
good.
that's why we're here
That's why
together.
we're here. That's why you're here, and that's why you're doing what you're doing. And we're
Yeah.
spending a lot of time and energy being clinicians and utilizing our knowledge so we can share that with women, so they can really thrive in the world. Yeah,
Yeah. Perfect.
yeah, yeah.
Any last words?
I don't think so. I just
No?
think, really just tune into your body. And I just want to say, it's never too late to start looking at hormones. I
Mhm.
have women in their 70s, 80s who are still having hot flashes or whatever, and it's never too late. But the earlier you start, the more protective
Mhm.
hormones are going to be, and the more balanced and less um, imbalanced you feel. And that's just going to be a more beneficial path moving forward for you. And so I just recommend kind of keeping an eye on that. And that way, you're not caught behind, and you can just kind of keep going smoothly, and keep sharing your gifts out there, people. Women are
Sweet.
amazing.
I'm glad you brought that up, because I forgot to ask you that about people that were,
Yeah, never
may
too
think that
late.
it's too late. Yeah.
Never too late, but the benefits
Yeah.
in the studies do show that it is more beneficial if you start earlier, particularly
Mhm.
around brain protection, and your bones. Sometimes the bones
Mhm.
are asymptomatic. We
Yeah.
don't know if our bones are getting broken down. And so the earlier we can start some treatment, cardiovascular system, similar, hormones are important for
Mhm.
that. If you can start that earlier, then you're more protected longer. Yeah, so your body's in a more optimal state for longer. Yeah.
Perfect.
Well, it's such a
Awesome.
pleasure. Thank you for inviting me and doing this work and getting out this potent message, and in general, just helping women find more resource to thrive in this world. It's really important work.
Thank you for joining me. I really very honored to have you here as my guest. So
All right. Have a nice day.
you too.
Okay.